Hola YouTube and welcome back to my channel. I am your girl BeautyByLinnoria across all my social media platforms. If you would, hear me out with my story today. Of course, I definitely want you guys to go ahead and thumbs up the video, share your experiences, or have a conversation with me in the comment section below. Share it amongst your family and friends. But as you already guessed from the title, coronavirus. You were like, when we haven't seen you since February. I'm very active on Facebook. I'm just not on anything else. You know what I'm saying? Like, still have my Instagram, still have my YouTube, but coronavirus. You know, I wanted to be able to talk about my experience and bring my experience to you guys, just so you guys can get a one-on-one experience as far as what it felt like to go through that situation. So if you're ready to find out exactly how we go from being completely normal to wearing masks and washing hands for 20 seconds and just all of the other stuff that we do to not even knowing where I contracted it from, testing negative with the nose swab, only to still have all the symptoms, problems, and issues that come along with the coronavirus, to 3 weeks ago getting that antibodies test to come back positive. So you ready to hear about how could you test negative, but yet it's positive virus in your body, in your system? Keep on watching, guys. You might be the one taking me home. One thing really lead to one. Okay, guys, so for me, my whole coronavirus situation started back in March. 2020 started off pretty normal for most of us, like any other year. This is going to be our year. We're going to get our weight together. Yes, bitch. We're going to get our love life together. We're going to get our education together. We're going to get our career together. You guys know last year when I had my hysterectomy surgery in August of last year, I was 343 pounds when I had my surgery. 2 days later, when I left the hospital, I weighed in at 339 pounds. Going to my doctors and weighing myself here in the past few weeks, I'm down 42 pounds. So I'm sitting up here thinking like, yeah, 2020 is the year we're going to get our weight under control. We're going to get healthy. It started off pretty good. Guys know I switched from working at Nestle, Purina, to working for the manufacturing company that I work for now, starting a new job, learning stuff, just experiencing, just growing emotionally, spiritually, just growing and learning different things in a new career field. And then Kobe died. And then you're just like, how can, like, it was just weird. It was just like, this just doesn't make any sense. In January, I know here in the United States, there were already rumblings and reports about the coronavirus. The doctors in Wuhan finally diagnosed it in December of 2019. But now they're starting to go back and realize this thing was already happening October of 2019. So a lot of people who had a prolonged cough, chest problems, difficulty breathing, just all these weird symptoms and different things. And you was like, damn, this flu lasts 2-3 weeks. What's going on? Odds are a lot of people already had it October, November, December, January. October, November, December of 2019 and January, February of this year before we really realized worldwide what it was and what was actually happening. So unfortunately, a lot of people who may have died during that time period aren't a part of the numbers right now because it wasn't something that you could test for or even knew about. Fast forward to what's happening in the United States underneath President Trump. We're going to go into February where they still aren't taking anything serious, still aren't really paying attention. And now you're starting to get more rumblings of this thing is happening. This thing is killing people. This thing is rolling. Like, it's a virus coming. The World Health Organization, they declared it as a pandemic. I'm going to leave 2 websites below for you to get your information from. I don't care what anybody says. There's only 3 places you should get your information from: the World Health Organization, the CDC website, and your primary care physician. If you don't have a primary care physician, reach out to the nurses or doctors hotlines at your local hospitals, because they can provide you with information and or resources if you're going through something or if you may have been exposed. And they can also let you know where you can go for different testing sites and centers, just so you guys know. So in March, in America, we really started to realize, okay, this thing is really starting to amp up. This thing is really starting to get crazy. So middle of March, I take advantage of my company's COVID-19 leave policy, because obviously schools and everything have shut down at this point. And all of these schools are now having to basically send all these children home to homeschool them. Let's go ahead and talk about that. I think it was horribly fucked up the way they sent all these kids home. It's like they made a snap decision without thinking it all the way through. And the reason why I say that is because a lot of our children are fortunate enough to come home to a house where they have laptops, tablets, computers, Wi-Fi, food, loving parents, loving family members, a safe environment. But a lot of those kids go home to houses where they're abused. A lot of those kids go home to houses where they don't have Wi-Fi. They don't have computers and tablets. Maybe their parents can't afford it, or something else more sinister may be happening. A lot of those kids go home to households to where the only real meal they ate that day was the food they eat in school. They don't have food at home like that. So the fact that you completely bottomed out and didn't have a safety net for our children here in this country, and you just, like, no one's acknowledging that. No one's acknowledging that you just pretty much just shove these children out with absolutely no type of recoil. Although we've had a lot of businesses and organizations step forward to try to make sure that these kids are being fed, these kids are safe at home, there isn't any type of abuse happening with the children. We're trying to get, more Wi-Fi across the United States so these kids can make sure they can actually get online and actually complete their school assignments. That just completely rubbed me the wrong way. Back to my story. I took advantage of my company's COVID leave because my children, I've been pushing and working so hard to get them to be the best they could possibly be coming through high school. I wasn't going to take my foot off the gas right here coming up on a senior and a junior. I wasn't going to take my foot off that gas with them. If anything, I was going to push harder. Be like, go get every grant you can. Go get every scholarship you can. Set yourself up in the best position to go off to college and have a complete full ride. We're going to do that. We've come 17 years. I'm not going to allow 3 or 4 months to completely derail 17 years worth of work. So I was blessed enough to have a job to have a COVID-19 leave policy, so I was able to take time off to make sure my children were able to get onto their online classes, do their schoolwork, access their schoolwork, make sure that with so many more people being on the internet at the same time doing that type of work, that the speeds were correct here at the house, making sure they understood their lessons, different things like that, just making sure that anything they may have needed, they had. I was blessed. I know a lot of parents out there, they didn't have that luxury and they weren't blessed that way. So I'm very grateful to General Mills for having that type of program in place to think of their employees not just as numbers, but the human aspect. I'm very grateful to my job for that. That time goes by and I can't even tell you where I got infected. I really can't even tell you where I got infected. I can remember going out grocery shopping. States at this point in March and April, states had started shutting down. People were dying. Clusters and different things were popping up. Like, people were scared. People were just scared. The only time we really went out was to get groceries, gas, on the huge hunt for toilet paper, Lysol wipes, bleach, Pine Sol. Just these type of things. So I can't even, I can vividly remember one of the last days I actually went out to where I may have been exposed. I can vividly remember going to Target, Walmart, Publix, a gas station, drive through at McDonald's, stopping to help an accident. It was a horrific accident that happened. My husband and I, we were driving, and we came upon the scene of an accident that had just happened. Had to have just happened like, had to have just happened like probably like 3 minutes before we even came around the corner. And unfortunately, one of the people were deceased. We were out there when EMS arrived, when the fire department arrived, when the police arrived and closed off the road. I don't know if being exposed in that situation is what exposed me. I can't even begin to even tell you how I even got exposed. But I can tell you that about March 25th, 26th, I started to show symptoms. Now, the thing about it is, we're talking about February, March, and April in Georgia. We have pollen that just won't stop. Pollen in the South is ridiculous. And this year, pollen season was excruciatingly hard for me. As I get older, my allergies get worse. And everything was covered in pollen. I was coughing, having difficulty breathing, itchy, runny eyes. Like, it was just a hot mess. Pollen just made it. As soon as I stepped outside, I could feel myself doing that just because of the pollen. Like, just even rolling down my windows or getting out my car, I immediately was like, it just took a moment because that's how thick the pollen is here in the South. So a lot of the symptoms that I may have had early on, I didn't catch because I just wrote it off like, not me. It's not gonna happen to me. I mean, I'm not really doing anything to expose myself. I'm just out running essential errands, going to work, coming home. At this point, I had already been gone from my job for about 2.5 weeks. You know what I'm saying? So I wasn't even at work. The only time I really left my house was to go to the grocery store, go to Walmart, or something like that, and then took my butt right back home. If it wasn't something I needed, I wasn't going. A lot of days, my car didn't even leave the driveway. I don't know how early on the symptoms started, but I did realize that around the 24th, 25th of March, something was wrong. It started off with the sniffing and itching with the nose, the difficulty breathing, and I kept thinking like, okay, this is just pollen. That always happens to me during pollen season. And then what started to happen was I started to get mild chest pains. And I'm like, is my fat ass having a heart attack? What the fuck? What the fuck? Like, I would just be like, okay, what's going on? Like, you start to get all these thoughts running through your head. I was never anxious or scared or anything like that. At the same time, I'm going through the first onslaught of my symptoms. I get news that 2 of my friends had caught it and one of them passed away. Some of my family members were sick, not in my household, but, in my family, like at large. You're talking about your cousins, your aunties, your relatives, stuff like that. Some of my family members had caught it and they were sick. And I can remember sitting on the phone talking to my friend down in Louisiana and just hearing the way he was breathing. I can remember sitting on the phone and talking to, one of my family members and just hearing the way they were breathing. And I was like, they're breathing kind of like the way I'm starting to breathe now. And for me, I guess it hit different because I had a front row to COVID-19 because I saw what happened with my family. I saw what happened with my friends. One made it and one didn't. And during this time, I'm just pretty much quarantining myself. Don't know if I have it. I don't know what's going on. I know something's off. You know how you just, if you listen to your body, your gut, the God in you, whatever it is, you can feel when something's off. I just knew something was off. I knew something was just not right. So I wasn't around my kids and stuff. I was just like, just trying to figure out what was happening. And I would literally be laying in the bed and my chest pains would just be like pumping, like, uh, uh, uh. And I could feel it. And it was like a pressure and a weight on my chest. And it hurt, but it didn't like, on a scale of 1 to 10, the pain was probably like at a 3. But it was enough for me to be acutely aware that something is happening. And I can remember talking to my husband a few nights and letting him know, hey babe, something's wrong. Like something is wrong here. Like, I need to go to the emergency room. I don't know if I need to call my doctor. Something is wrong. What finally made me reach out to CVS and my doctor to get scheduled for testing was probably like around the 1st or 2nd of April. I was laying in bed and another symptom of coronavirus hit me. It's the crawling skin. You know how like when you have the flu and like you just can't get comfortable in your skin. You can feel your skin, but you can't feel your skin. You just can't get comfortable. Or this is gonna be the gross part, but this is the best way I could explain it to you. So if you have the symptoms, you'll know to reach out for help unless you're asymptomatic carrier. You know how like when you're constipated and you gotta go to the bathroom, I know you're like gross, but real tea, real talk, I'm telling you something that may help you or someone around you. You know how like when you gotta go to the bathroom and you can't, number 2, and you just sitting there and you just feel like cold and chill, but you just like, you can feel every inch of your skin but not feel it. That's that feeling of crawling skin. That's a symptom of coronavirus. When they keep saying fizzy skin, like your skin feels fizzy. A lot of people's like, what the hell is fizzy skin? That's what fizzy skin is. When I started to feel that with the chest pains and the breathing, I was like, what the heck? And I have a superb sense of smell. And I'm very picky about my food. So for about not even a cold day, I didn't even really notice it, that I couldn't actually taste my food or smell anything until I was in the shower taking a shower with my Dove body wash that normally makes my bathroom smell like a spa. And it just dawned on me, I can't smell shit. And then I was like, I immediately got out of the shower, ran and got a coffee in my Keurig, made a cup of coffee, and realized I couldn't taste the taste of coffee. I called my doctor's office, and this had to be like 10, 11 o'clock at night. I knew I was going to get the after hour service. I just started explaining to him, telling him. He was like, well, ma'am, that's a different type of situation. It could be coronavirus. So after speaking to him, he was like, call the emergency room, talk to a nurse. You know, I was just sitting there talking to my husband at the time. And I was just like, something's just not right. Something's just not right. They had just started doing testing here in Georgia. CVS had just opened up one of their first testing facilities here in Georgia, and it was here in Metro Atlanta, over at the Georgia Tech campus. And I had been looking at their website all week, like maybe I should just go ahead and sign up for a test. But I kept saying, no, I don't need to go do a test. I don't need to go do a test. But after I got off the phone with him, I went ahead and went through the process of trying to go get a test at the mini clinic CVS is doing over at Georgia Tech. Next day, I called and talked to my doctor, and explained to him the symptoms and everything that I was going through. Mind you, I am about 10 or 11 days into my symptom at this point talking to my doctor. He's like, you sound like you have all the symptoms and everything that are associated with the coronavirus. We need to go ahead and get you testing. We need to get your results. Per CDC guidelines, we need to put you underneath the 14-day quarantine, which I think is weird. And I'm going to tell you guys why in a moment. Fast forward, I finally get a test and a date set up for a test. 10 days later. April 11th, I go in to do the test, the soul swab test. I'm going to go ahead and insert the pictures of me going to the testing facility and everything down at Georgia Tech. We self-administer the test through our nostrils. They're asking all these questions, taking down all your information and everything. Like, the police presence is heavy. Nurses and doctors are there, you know, for the test. It's a 15-minute rapid result type test. So I do the test. I shove the little cotton swab thing in both my nostrils and everything. I don't know if I just didn't do it correctly and I just didn't put the swab in far enough, or so that day getting a test. It's a rapid test that you get your results back in 15 minutes. You do the test. It was a self-administered test. I don't even know if I pushed the swab far enough back in my nose to even do that. I don't know. So you pull into these little stalls and you can't leave until you get your test results. So I got there super duper early. Like, my test was like at 10 o'clock in the morning. I think I got down there like at 9 o'clock. I was the third person in line. In your car. Obviously, you got to stay in your car. So by the time they actually opened and started allowing the cars in, had to be about 150 cars there by 10 a.m. So I'm sitting in my car waiting on my test results 15 minutes. When I tell you waiting on those test results was more stressful than waiting to hear back about a job you didn't interview for, waiting to hear back if you were pregnant, waiting to hear back about your STD results, waiting back to hear about any type of scans your doctor had to do, or specialty scans a doctor had to do, or a hospital. That was the most stressed I've ever been in my life. And I have 3 children, and I just came through 2 surgeries back to back last year. You know what I'm saying? So for me, I was just sitting in the car like, I don't even know. I wish my test would have read positive. So that way my other experience wouldn't be about what I'm about to tell you guys. I get a phone call from one of the nurses. She lets me know I'm negative. Lets me know what I need to do. Obviously, you still have to quarantine. Because even though you test positive, other things could be happening to where you're not positive. Even though you test negative, other things could be happening to where you were exposed. You still need to quarantine for 14 days. At this point, I have been sick for about 3 weeks. Yeah, I have been sick for 3 weeks. So I get my negative results. They come over, they hand you the results and everything. A cop will walk over to you and hand you your negative results and be like, did the nurse call and tell you what you need to do? Yes. Okay, you're fine. You're free to leave. Obviously, while I was sitting there waiting, the car to my left and right, the car to my right results must have been negative, because his little police officer walked over, handed him paperwork, and he pulled it off before I did. The car to my left must have tested positive, because the nurses came in this whole get up with this face shield, gloves, gown, coat, everything. The police officer, he was completely covered in everything. They walked up to the car. They had this little thing to where they actually physically didn't hand the people the paper. They handed them, the paper was attached to this rod that they had held out. You know, did you get the phone call? Did you explain? You know what you need to do? I was just like, Jesus. So I leave there, you know, I let my family members, loved ones know who knew I was going to go get tested today. Hey, I tested negative. I'm fine. I'm cool. So I thought, problem with the test is we have so many different coronavirus tests. I'm specifically going to be talking in reference to the United States. Obviously, that's where I am. We have so many different tests. They're not standardized across the board. So the error in the tests are just staggering. The way they are administered, how the results are read, how quickly the results are given back, the fact that milder symptoms of the coronavirus typically dissipate within 7 to 10 days, which is why they have the 14-day quarantine period. Why, from the moment you test positive, they give 14 days for you to be able to test negative twice within a 24-hour period before they clear you and release you back to the general public. Well, in my case, I tested negative, but I had been sick for 3 weeks. I knew I was sick. I knew I wasn't feeling well. I knew something was up. Because of the type of testing we have in the United States, because of how sporadic it is, as far as the type of test we have, the way they do it, the way they administer it, the way they run the results, the way they do the notifications, it's about a 30% error rate with our testing in the United States, which means 30% of the people who receive negative results are actually positive. How that happens is, from what I understood talking to healthcare professionals, one, you're testing too soon. You just got exposed to the virus here in the past 2 or 3 days. It's not enough virus in your body yet to have made it to your actual nasal cavity for it to actually test positive, even though you are positively infected with the coronavirus and you're currently shedding the virus everywhere you go. You can be asymptomatic. That's another way you can test negative for the coronavirus if it hasn't actually produced enough in your body yet to actually show and register on an actual test. You could have had it 7, 8, 9, 10 days ago, but because your body has started to fight it off and it's starting to dissipate now, you're starting to get over it, you're testing too late, which means the virus has started to withdraw itself from your body. So now when they're going into testing, they're not picking up enough for it to read positive because your body's already started to fight it off. So even though you are currently infected and positive, there are 3 situations to where if you're not careful, you can actually infect other people, your loved ones, people at Walmart, Target, Kroger, Hen House. Hey. I'm filming. Can I call you back? So I sit there and think, like that day when I left, if I would have known then what I know now, I wouldn't have went to Walmart. I went to, because I left there and went to Walmart. I'm negative. I'm fine. I'm cool. Maybe it was just all in my head. Maybe I'm just overreacting. Sometimes stress can put you in a self-induced situation to where you start to mimic certain symptoms and it becomes very real within you and your body. But it's really not happening, but it's the stress of the situation, the anxiety of the situation actually manifests it to happen, even though you aren't currently. It's weird. I left negative. Okay, fine, cool. Reached out to my employer, let them know. Reached out to my doctor, let them know. Let my family, loved ones know. Went to Walmart. Had to go get some stuff from Walmart. Had to go get some stuff from Publix. Obviously, would have been this wholly different day had that thing said positive. Went home. Not even thinking about it, but I'm still having problems and issues. CDC requirements in Georgia, you have to wait a certain amount of days for your temperature to be under control. I had been having spiking temperature since about the 22nd of March. The 21st, 22nd of March is when I started to notice my temperature had started spiking. And here I am, April 11th, still having spikes in my temperature. It was a day when my temperature was 97 something, 98 something, fine, cool. And then it would spike at night. Oh, it would spike at night. It would be 102, damn near 103. And it would just constantly go back and forth with spikes. And here I am, 3 weeks into feeling bad and feeling in and still having the spikes of my temperature. Finally, my temperature calmed down. My breathing calmed down. My symptoms started to fade enough for me to have back-to-back days of not having a temperature to be able to go into my doctor's office. Went into my doctor's office. He did the different breathing treatments and things on me because the coronavirus makes it hard for you to breathe. So one of the first things, even outside of testing positive and testing negative, one of the first things that your healthcare professionals can kind of key in on, if they did breathing tests on you before in the past, is they'll be able to look at what your breathing test was prior and what you're blowing and breathing now. Or they already know what the normal breath should be for someone your height, age, weight, blah, 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 blah. And if you're blowing below that, they're going to start asking questions. Do you have asthma? Have you ever had any asthmatic attacks? Do you smoke? Are you currently having any type of allergic reactions? Like, they're going to start to try to rule things out as to where your breathing should be here, but you're blowing here. So there's a problem. We're not saying it's coronavirus, but we need to figure it out. I did 2 breathing tests with my doctor. I blew both of those perfectly fine. No problems, no issues. Didn't have no problems. He listened to my lungs. No problems, no issues. None of that. They took blood and did all that other stuff. Fast forward to, I went to my doctor. This had to be like April. I returned to work April 20th. I was supposed to return to work April 27th. So I went to my doctor. This had to be like April 20th. 20th, 21st, something like that. 20th, 21st, something like that. So, beginning part of May, I get test results for my blood. And I have antibodies. And I'm sitting up there going like, wow, I'm no longer contagious or infectious. I stopped being contagious and infectious back in the middle of April, like around probably April 18th, April 19th, April 20th, somewhere near, I overcame my coronavirus situation. See what I'm saying? And the first time I could really understand that I was sick from the symptoms that I was having was probably like March 20th, 21st, 22nd. So almost a month I was sick. Some parts were really bad. Some parts weren't. You know what I'm saying? I was just like, this entire time I was sick, I knew something was wrong, so I stayed away from people. I stayed out of the stores. I made sure that my delivery drivers left my food or whatever it may be outside, and then I would go get it. You know, I did my best I could to shield anyone else from me because I didn't really know what was happening, what was going on. I just knew something was wrong, and I didn't want my ignorance to infect someone else and they possibly go infect their family or someone dies because of my ignorance. That's the point that I'm coming from. I don't want my ignorance of a situation to be what causes someone else to get sick and possibly expose other people and or have them die or someone else die because of my ignorance. And I'm the one who exposed them. So I'm happy that I trusted my gut and just shut myself off from everybody in the world and everything. But when I got my antibodies test back and it was positive, I knew it. And I'm guessing my doctor knew it too. You know, just because of the testing and the way the testing was going and happening March and April, it was a hot mess. I'm thinking that the testing that they're doing now is better. I mean, I don't know. I'm hoping and praying the testing that they're doing now in the United States is a whole lot better than the testing we went through in March and April, because that was just a hot mess. That was just a hot mess. I've heard people saying they get their blood done now for the test or whatever. I don't know. But The coronavirus situation is very devastating for us all. Whether you're infected or exposed, someone you know or love, work with, just whatever it may be, or it hasn't reached your doorstep yet. Through certain degrees of separation, you know someone who's been affected by it. If they're not sick themselves from the virus, then they may have lost their job. Or they may have had to take a reduction in hours. Or they may have had a hit to their 401k because stocks just started to tumble. And just, I guess the whole reason why I wanted to come on here and tell my story about what happened to me and my experience was not only to be like, hey, where have I been? But I also wanted the opportunity to just sit down and just talk to you guys and just let you guys know that trust your gut. Reach out, talk to somebody, call the hospital, because when you call the hospital, they have a doctor's or nurse's line that can ask questions specifically about coronavirus, COVID-19. Talk to your doctor. Just reach out, talk to a medical professional. Don't be out here just taking wild, crazy concoctions to try to prevent it and or cure it. Talk to your healthcare professional. I'm positive that we'll get through on the other side of this situation together. I know there's been a lot of death and a lot of sickness. I know what should have been flattening the curve in the United States really hasn't happened. We've just had a shift in cases from some of the largest places like New York and New Jersey to now Georgia, Florida, the South. For some odd reason, the South. Obviously, I live in Georgia where my governor decided to open the state up for nail salons, beauty shops, and tanning beds and shit. How is any of that essential? And the beaches were reopened and everything. So we had a lot of people coming. The first weekend Georgia was open, I think they said we had a huge amount. Like I can't remember. I just want to throw a number out there. But we had so many people coming to Georgia to come to the beaches, to come get their hair cut, to come get their hair colored, to come get their nails done, to come eat and all this other stuff. The first weekend we were open, it was so many out of state tags here in Georgia. It was crazy. For those of you who can stay home and continue to self quarantine, self isolate, practice social distancing, please do. I know that a lot of us are essential workers, so you got to get up and go to work. Um, my prayers are with you and your family every day. Um, I would ask that people stop being assholes and mean to essential workers who are just doing their jobs. If they talk to you about having to wear a mask, or why we can't allow you to dine in right now, or why we aren't doing this right now because of this situation, I just wish people would stop being assholes and find more compassion and find the human part of humanity. We've had a whole lot of stories come out about essential workers just being disrespected, treated worse than, and murdered, all because they're just simply doing their jobs. And that I'm baffled watching the protests and everything happen, and some of the churches just defying orders to have to stay open, and just I'm I'm baffled by all of that. I'm baffled by all of that. When I say I'm baffled by all of that, it's because I don't understand how or what. I do understand that different states are going through it differently. But if you go from the first protest that happened, like, what was it now? Last month? And fast forward now, you're starting to see little hot pockets pop up of the coronavirus in those areas and states. And you're almost like, you're just wanting to tell people to be safe. Like, I totally get it. You think it's 5G. You think it's a fucking hoax. You think it was created in a lab in China. You think all this other stuff. I get it. We're all scared to a certain degree. No one's certain right now. And that is the truth. We all know that the second wave is coming for us this fall as it teams up and creates the perfect storm slamming into the flu season. We don't even know what that's going to look like here in America come October, November. We don't even know what that's going to look like for us. We know we've had reports and cases happen out of Florida and some other states to where they're now trying to minimize the numbers, minimize the deaths. Here in Georgia last week, our governor just got called out for fucking fudging the charts to make it look like our numbers were steadily going down when they're definitely not. Here in Georgia, they're definitely not. So all I can say is use your judgment. Be kind, be considerate. Try to stay as safe as possible. I would never want any of you guys that's listening that could actually hear me to ever have to experience, on a scale of 1 to 10, what I went through was probably at a level 5. It took about 3.5 weeks for me to get through my ordeal. I don't understand the 14-day quarantine when most coronavirus patients and survivors that they speak to say it lasted for about 3 or 4 or 5 weeks. So I don't understand this 14-day quarantine thing that they're talking about. I definitely don't understand that. And I know I'm definitely one of the blessed ones. I don't have for the coronavirus patients who are hospitalized, they are the more severe cases, and they are the ones who are starting to experience the permanent lung damage, the permanent organ damage that is happening to your liver, your lungs, your kidneys, your heart. It was something else that they was talking about. And, for them, I still pray. Because this could have been a 35-year-old man who was perfectly healthy up until a month ago when he got sick with the coronavirus. And now, although he's recovered from the coronavirus, his body now looks, acts, and behaves and responds based on the virus. It now mimics that of a 60-year-old. His lungs look like that of a 60-year-old. His heart has been damaged. His kidneys have been damaged. You see what I'm saying? So both ends of the spectrum, I'm still praying. Those people who are mad and upset and refuse to wear a mask, want to protest, you can't shut down this, you can't shut down that. I get it. We all had jobs. We all need to make money. I totally get that. So I see and understand it from both sides of the spectrum. And my only comment in reference to either end of the spectrum is I'm still praying. I know we'll get through it. I just don't know what the other side looks like. I know we are forever permanently changed by this. But I just want to say that thank you guys for spending time with me, listening to my story. Still being here with my channel and everything. If you have any questions or concerns, of course, you guys can leave it for me down in the comment section below. If you yourself has experienced anything with coronavirus and COVID-19, no matter where you are in the world, you can always leave your story down below. Other people can always respond. We're community. At the end of the day, we are all humanity. And humanity is about us being a community and embracing each other when need be, uplifting each other when need be, protecting each other when need be. And that is the idea that I think I've fostered so far on my channel. So there will be absolutely no conspiracy theories in my comments. There will be absolutely no hate, no bashing, nothing like that in my comments. I want it to be a safe place for people to just talk or express how they feel. You know, it's okay to be scared. It's okay to be anxious. It's okay to have PTSD from the situation. It's okay to know that you're not okay and you may need therapy. There's nothing wrong with that. That's human. So, thank you guys so much. I love you, you too.